Let's ventilate a patient. A simple guide for beginners. I will demonstrate how to use the Zoll portable ventilator. Switch on the machine by turning the dial in a clockwise direction. First, press the button with a cross. Select the adult mode using the dial and press the tick button. Let's now take a look at the buttons and their settings. FiO2 tells you how much oxygen we are giving the patient. In critically ill patients, we usually start with 100 and then gradually step down. The next button is for pressure support settings. The next button is for volume settings. Next is the button for respiratory rate and IE ratio settings. The last button is for ventilator mode. Check whether the tubes are attached correctly at the back of the machine. Before we learn about the ventilator settings, we must first refresh our minds about the lung volumes. This is a spirometry diagram of a normal adult. The tidal volume is the amount of air that is inhaled or exhaled during each respiratory cycle. It typically measures around 500 milliliters for adult males and 400 milliliters for adult females. The inspiratory reserve volume is the amount of air that can be forcibly inhaled after a normal tidal volume. The expiratory reserve volume is the amount of air that can be forcefully exhaled after a normal tidal volume exhalation. The vital capacity is the maximum amount of air a person can expel from the lungs after a maximum inhalation. It is equal to the sum of inspiratory reserve volume, tidal volume, and expiratory reserve volume. Residual volume is the volume of air remaining in the lungs after a maximal expiration. Functional residual capacity is the volume of air remaining in the lungs after passive exhalation. Total lung capacity is the volume of air in the lungs upon the maximum effort of inspiration. To calculate the minute volume, you need to multiply the tidal volume by the respiratory rate. There are two main ways of ventilating a patient. We can deliver gas at a fixed pressure. Then the volume delivered to the patient will vary depending on the resistance of the airways. Or we can deliver a fixed volume. Then the pressures within the airways will vary. Let's look at the commonly used ventilator modes. Ventilator modes on our Zoll ventilator are invasive ventilation, AC and SIMV, a non-invasive ventilation, spontaneous modes, a CPAP and BL, BiPAP. We commonly use either pressure control or volume control settings in SIMV or AC mode. In AC mode, a fixed number of machine breaths plus patient-triggered breaths are delivered at a fixed volume. In SIMV mode, a fixed rate or volume of machine breaths plus patient-triggered breaths limited by patient's effort. Now let's look at some settings. We often use AC, V, or SIMV, V, mode. We calculate the tidal volume as 6 to 8 milliliters times the body weight of the patient. BPM, breaths per minute, is the respiratory rate. We set it around 12 to 14. We increase the rate if we want to wash out CO2. IE is the ratio between the inspiratory and expiratory times. It is normally set as 1 to 2. We may change this ratio to 1 to 3 or 1 to 4 if there is CO2 retention as in bronchial asthma or COPD. The PEEP is the peak end expiratory pressure is set at 5. We may increase it to improve oxygenation or if there is pulmonary edema. PS is the pressure support. This is used to assist the patient's respiratory efforts and can be set around 10. FiO2 is the fraction of inspired oxygen. We start at 100 then titrate down gradually depending on the SpO2. How do we change the settings? First, press the button of the parameter you want to change. Then use the dial in the middle to change the setting. Confirm your setting by pressing the tick button. Here are some points to remember. Make sure your patient is adequately sedated and paralyzed. We generally intubate a patient using succinylcholine. This is short-acting drug and must be followed by a long-acting drug such as atracurium. Intermittent intravenous boluses are required to maintain paralysis. Generally 20 to 45 minutes after the initial dose and repeated at regular intervals. Maintaining the sedation is also important. You can use a midazolam and morphine infusion. Add morphine 15 mg, 1 vial, plus midazolam 15 mg, 3 vials, plus distilled water to make up a total of 15 milliliters in a 20 cubic centimeters syringe. This will give you a midazolam plus morphine solution of 1 mg per milliliter. Run it at 1 mg to 2 mg per hour. How do we know if the patient needs a top-up atracurium dose? When the patient starts to breathe spontaneously. How do we find out? You may be able to observe bucking, abdominal wall movements. Patient may start to move. The ventilator may start firing an alarm. Capnography.